Governors of Texas and Mississippi rolling back most of their COVID-19 restrictions, including those statewide mask mandates. We want to talk more about this with Dr. Dori Russ, the medical director of the Russ Group. And Dr. Russ, great to have you on the show. The decisions that we just got out yesterday from Mississippi and also from the state of Texas. Big question is it too soon to do this? What do you think?
Well, we have the numbers. We know that in Texas, about 12% of the adults have been immunized. Our concern is that when the theory of herd immunity, we're actually shooting for about 70%. So it's going to be a matter of people still using all of the health imaging that they've received over the past year, still social distancing, still washing hands, still, if they choose, wearing a mask to keep the numbers mitigated.
Dr. Russ, I was curious what we should consider when a state like Connecticut has changed the protocol by which they inoculate. They're just doing it by age now. They still prioritize teachers, first responders, that kind of thing. But now they're doing it in blocks. I think it's as young as 55, whereas states like New York are not doing that. Is one or the other a better way to do this?
I think we all hope that there'd be a coordinated response, but we do understand that states know their populations best and they can assess where the most benefit from an impact will come. Again, I'm down in Florida, so we've been different than everyone else in the country since it began. But again, we have a huge senior population. Again, a coordinated approach would have been preferred, but as long as states are actively notifying their citizens that they can be vaccinated, that they're going through the process, the goal is to get as many people vaccinated as soon as possible.
And Dr. Russ, just give us a better picture of what exactly is going on in Florida right now. Do you have access to the number of vaccines that you needed? And how has that process been going over the last several weeks?
So yes, Governor DeSantis on Friday actually just issued a new emergency order allowing patients with chronic medical diseases to be immunized. So that's been huge, especially for the patient population that I serve. So again, we started with healthcare workers, then we started with senior citizens, and we actually had our first cutoff at 65, whereas most states had 75. Then we opened it to vulnerable populations, but they had to have documentation from a hospital setting, and now it's open to the outpatient setting for those same patients. We are one of the states that are immunizing pregnant women. And again, that's been something that's been very popular to talk about because, again, pregnant women weren't included in the trials, but most of the academies have come out and stated that the benefit of the COVID vaccine outweighs the risk to pregnant women as well. So that's exciting to see that we are part of that curve and getting everybody immunized as fast as possible. One of the biggest things that we've had to deal with in Florida are health disparities, of course. And so initially there was a problem with both vaccine hesitancy, where certain populations didn't want the vaccine and certain populations didn't have access to the vaccine. And so making sure to address educating those populations to understand why it is critical was part of reducing vaccine hesitancy and opening up access in a variety of centers, whether it be partnering with faith-based organizations, using different community centers, as well as different state agencies to make sure the vaccines were able to be distributed.
I'm curious too, Doctor. A native Floridian here, both of my parents in South Florida got their vaccines, thank God. I saw that Publix is going to start offering vaccines. It's the big supermarket chain down there. What is Florida doing right compared to New York? Almost to the same size. Florida's a little bit larger. You vaccinated more people. It's more than 2 million. We vaccinated, I think, roughly 2 million. But your outcomes, the number of infections, the number of deaths, I think Florida, despite its less rigorous lockdown than New York, has actually fared better than New York. Is that accurate? Is there something in play there?
I will do full disclosure. I think there's always been a question to how accurate Florida's reporting of the numbers are. I'm just going to put that out there. If we assume that the data is accurate, then yes, again, we have a lot of places where people can go outdoors, where they can socially distance. And that might be one of the contributing factors if we assume the data is correct. If we assume that there's a problem with the data, that leads to a whole host of questions that I'm unable to answer, but have my own personal thoughts.